Hey guys, Dr. St. Louis here. I had a quick something that I wanted to share with you that has to do with insurances and authorizations for pelvic surgeries. Recently, we had an insurance deny a surgery for a patient that has severe pelvic organ prolapse, meaning her bladder, rectum, uterus are completely outside of the body, causing many different symptoms. You can have bladder symptoms, you can have pressure and pain and discomfort. You can have decreased social interactions with both the outside world as well as your significant other. This can cause bowel problems as well as in general pelvic floor dysfunction. And this insurance denied her procedure. Now, you would think that if your organs are falling outside of your body, that an insurance company would be willing to pay for the procedure. But one of the things that they said to the patient in their denial, which is sent via a mailed letter, they listed 10 different reasons why the surgery was denied. And it basically said that the records have to show these criteria. And the number one was that your uterus has to fall below the opening of the vagina. Okay, so it can't just be halfway down, it can't be almost at the opening. They want it below the opening. You have to show that your problem did not get better after trying other treatments, even if you do not desire to try other treatments, or if other treatments are not conducive with your lifestyle. They denied it because you don't wish to use a pessary, which is something that can hold your prolapse up. But this is oftentimes not a choice for certain patients, or it's not a feasible option for certain patients. So they denied it for that reason. And they denied it because it has to show that they're having problems with pelvic pain or pressure. The notes have to show that they have severe bladder pain or problems controlling their bladder. And the notes have to show that they have frequent urinary tract infections or urinary incontinence, which sometimes those symptoms have nothing to do with pelvic organ prolapse. It has to show that they have sexual dysfunction because of their prolapse, and that they have ulcers or bleeding because of their prolapse. And also it has to show that they've had a normal Pap screening test. So this healthcare plan decided, because those 10 criteria they didn't see somewhere or hear from the patient, that they were going to deny her surgery to help her prolapse. And one of the things that's important for you guys to know, that as physicians, we deal with this quite a bit. And one of the things we do is during our history taking process and the questionnaires that we have you fill out, we ask you all of these questions. So for instance, every one of those types of symptoms are addressed by our new patient intakes. We ask about pressure, we ask about pain, we ask about bleeding, we ask about other treatments you've tried in the past. We've asked about side effects or problems you've had with those treatments or why they're not conducive. We ask about urinary tract infections. We ask about urinary incontinence. We ask about bleeding, and we ask about sexual dysfunction. And I think it's just interesting to show that even though we ask these questions and even though we put them in our notes and even though we send them to insurance companies, they still will deny certain claims. And one of the things that's important is for patients to also call their insurance companies, question them, ask them, why are you denying this? And a lot of times we have to send the records multiple times and we have to just go through that fight for them to approve something. But I say this to you just so that you know that for one surgery to be approved, they want 10 different things to say why it should be approved. And uh, in my opinion, sometimes one is good enough. But we have to go through this entire process and it can be exhausting. But just so you know, we're here and we're here to help.